So hi students, again every year we are summarizing all the updates in alphabet mode. For this year till now, what are the updates important for your exams? I am summarizing it in alphabet mode A to Z so that it will be easy to recall for you in the exams. So let's start your updates section. So I'll summarize all the updates whichever is important for your exams in alphabet mode. Clear? So let's start with alphabet A. Antara, contraceptive. It's an injectable contraceptive. You can see the image. Antara, it is an injectable contraceptive, progesterone based contraceptive. So it is DMPA. Depot preparations of medroxyprogesterone acetate. So it's an injection never contraceptive under family planning. So it is given once in 3 months. So it is an injection depot preparation, so it can be given once in 3 months. Antara means gap. So once in 3 months injectable contraceptive, progesterone based contraceptive, answer is Antara. Next, Anmol. So it is an application. So it is a mobile based application. ANM online. Anmol ka full form is ANM online. ANM is auxiliary nurse midwife, female health worker, located at sub-center level. You know this. So for data entry purpose, who are the beneficiaries in her locality, what are the services given to her, what are the pending services to be given. So for data entry, a tablet is given along with that an application so that it is easy for data entry at sub-center level. ANM online, it is like we say Digital India, going to mobile software based application. So it is one of the initiative for data entry. ANM online. Next, Amrit, affordable medicines and reliable implants for treatment, full form. So Amrit, we have Amrit stores, Amrit pharmacy at different hospitals, just like we have Janaushadhi stores in different localities. Amrit is giving affordable medicines, not free of cost, but at an affordable rate. Clear? One thing. And also implants for treatment. So usually what is happening, cancer patients, drugs are very costlier in the retail market. So government is bringing this scheme through this pharmacy stores. The drugs are given at affordable rates. One is cancer, main thing, and second, cardiovascular disease. Mortality is more. Stents, yes, implant stents are costlier outside. So through Amrit, medicines and implants are given at affordable rate, mainly to prevent mortality, to reduce out-of-pocket expenditure, especially for cancer drugs and cardiovascular stents. Clear? They can ask questions on this. Come to next, important A for AIDS disease. Within AIDS, you need to know 3 things. One is treatment. Second, PPT-CT combination. Third, post-exposure prophylaxis. So one is ART, antiretroviral therapy. All HIV patients will be given TLE combination, tenofovir, lamivudine and efavirenz combination in India. So TLE combination, we have to start treatment as soon as diagnosed. So it is test and treat policy, irrespective of CD4 count, irrespective of clinical staging. The patient is diagnosed to be HIV positive, start treatment. TLE for lifelong. This is test and treat policy for antiretroviral therapy. Now come to PPT-CT. If the mother is HIV positive, what has to be done to prevent transmission to the child, like prevention of parent to child transmission? The drug given in pregnancy is TLE, same as HIV positive patient. Start TLE. It can be started in any trimester, irrespective of gestation, irrespective of CD4 count. So as soon as diagnosed, you can start TLE now. Clear? and it will be continued for lifelong. And for newborn, we have to give prophylaxis using nevirapine at least for 6 weeks. Minimum duration is 6 weeks, where you do DNA PCR to confirm early infant diagnosis can be done at 6 weeks, and then if the child is positive, you can start pediatric ART. But nevirapine, the role is prophylaxis. Clear? Pregnant, TLE, newborn, nevirapine, minimum duration 6 weeks of nevirapine. Come to post-exposure prophylaxis. If there is an exposure, what has to be done to prevent transmission? So what we are using in India, NACO guidelines says now tenofovir, lamivudine and lopinavir ritonavir combination. Tenofovir, lamivudine and lopinavir ritonavir combination is better than TLE. So if this combination is not available, TLE can be used. This is NACO guidelines. Clear? But what WHO is saying, tenofovir, emtricitabine and dolutegravir is better combination. This is the best combination. What WHO is advising, this is the best combination. But in India, what we are using, tenofovir, lamivudine, lopinavir, ritonavir combination is better than TLE combination. But in WHO guideline, this is the best combination. TED combination is best. The duration is 4 weeks. The duration is 4 weeks. So depending on the question, if the question comes as per NACO guidelines, prefer this answer. The question says as per WHO, prefer this TED. And which is best? TED combination is best. Duration of post-exposure prophylaxis 4 weeks. So remember ART, PPTCT and post-exposure prophylaxis. Within AIDS, one more thing will be asked, 90-90-90 targets. For HIV, 90% of the patients should be detected. Out of 90 detected, 90% should get proper treatment. And within those 90 treated, 90% should have proper viral suppression. So it is detection, treatment and viral suppression. Clear? This is one of the national health policy target, 90-90-90 target for HIV AIDS. This has to be achieved by 2020 and this was not achieved. So 90-90-90 target is for which disease? HIV. What is 90-90-90? Detection, treatment and viral suppression. Come to next alphabet B, blindness. Initiatives are important. What are the newer updates you should know? 1. The program, National Program for Control of Blindness and Visual Impairment. This VI has been added now. Before it was only NPCB. Now it is National Program for Control of Blindness and Visual Impairment. That is also included in the program to manage refractive errors. The cutoff of blindness for Indian conditions and also WHO, we are following the same guidelines now. Visual acuity of less than 3/60. Before India was using 6/60. Now it is following the same WHO guideline, less than 3/60. The recent prevalence of blindness, this is the updated prevalence of blindness. It is 0.36% in India. So this is the most recent value. Prevalence of blindness in our country. And one more thing important, what is the target? Target is 0.25 per 1000 by 2025. This is National Health Policy target. This is the updated one, important, 0.25 per 1000 by 2025. You can remember the number 2525, 0.25 per 1000. Don't make mistake, it is not percent, it is per 1000 by 2025. This is the recent target set for blindness under National Health Policy. One more update in blindness you should know is trachoma elimination. What is the target to say trachoma has been eliminated from a given country? The prevalence of active trachoma infection. The prevalence of active trachoma infection in less than 10-year children. In less than 10-year children should be less than 5%. Remember, less than 10-year children survey you do, if the prevalence of active infection is less than 5%, 10 and 5, so less than 5%, 10 less than 10 year children, 5 is prevalence less than 5%. If that target is achieved, you can say that country has achieved trachoma elimination target, and India has achieved it in 2017 itself. So when 2017 the survey was done, the prevalence was around 0.7%. So it has been achieved already. So trachoma elimination target has been achieved by our country. Yes. What is GET 2020? GET 2020 is global elimination of trachoma. WHO has set a target of less than 5% to be achieved in all the countries by 2020, and India has achieved that target also. GET, global elimination of trachoma 2020. Clear? Good. Come to next alphabet, C. Chaya, contraceptive. See the image. Once you see the image, you will not forget. That's why I am giving one term, one image and discussion. Term, image and discussion. Good. C for Chaya, C for centroman. Remember, non-steroidal OCP. Before it was coming as Saheli, now it is centroman tablets, oral, non-steroidal oral contraceptive pill. It's a part of Mission Parivar Vikas, new family planning methods, correct. How it is given? Twice a week for first 3 months. Twice a week for first 3 months. Then once a week. Once a week pill, that is not in the initial 3 months, that is after 3 months. Clear? Twice a week in first 3 months, once a week after 3 months. Chaya pill. C for Coven. Coven. See this image. Yes. You know, even is for all the vaccines, electronic vaccine intelligence network. Once we started delivering vaccines, COVID vaccines to our country from March 1st, we need one more way to track the data related to vaccine, beneficiaries, registration for all these purposes, especially for COVID vaccine delivery and tracking the status of COVID vaccine. We are having one more application, that is Coven. So what is Coven? Yes, related to vaccine. Which vaccine? COVID vaccine. Yes. What is the purpose? To track the data for what? Vaccine delivery, even storage conditions, correct. Stock, correct. If I want to get vaccine, I'll register through this, correct. So it is important to track the vaccine delivery and receipt status. For that, related to COVID vaccines, we have an application, that is Coven. Coven is for COVID-19 disease, for vaccine delivery status, to track that, important. Come to one more update, cancer, non-communicable disease. You'll be asking, sir, what is the most common cancer? At this point of time, for male it is lung, for female it is breast. Very simple. For male it is lung and for female it is breast. So the most common cancer in males, lung, female, breast. If they ask the leading cause of death related to cancer, in males same lung, in female same breast. So this is the data released and this is the data update related to cancer. Come to next alphabet, D, Dakshata scheme. So in this, the health workers, the healthcare providers, nurses, ANMs, medical officers, they are given training for intrapartum care, how to conduct delivery practices, and immediate postpartum care. Just after delivery, the risk of death is more, maternal mortality is more, how to manage PPH. So Dakshata is training, one, for healthcare providers, correct, for intrapartum and immediate postpartum care, correct, to reduce maternal mortality, correct. Clear? Good. Next alphabet, E. So even, so see the logo of even. This is the logo of even. Full form, Electronic Vaccine Intelligence Network. So related to vaccine, what is the purpose of even? It is a mobile based application where the cold chain coordinators, they'll be entering the data. See, at my cold chain center, I have this much of vaccines available. Out of 10 vials of BCG, 8 vials used, 2 vials left. Like that, they'll be entering the data entry into this system, so that the higher authorities, they'll be knowing what is happening at cold chain centers. So it is an intelligence network related to vaccines, so that we can keep a track on data of all the vaccines. CoWIN is only for COVID vaccine, but even is for all the vaccines used under National Immunization Schedule. They will also enter cold chain temperature also at that locality, date, and they will enter the cold chain temperature. So even is used to monitor vaccine stocks, yes, correct, and also cold chain temperature, correct. See the logo of even important ESI scheme. See the logo of ESI, it is under Ministry of Labor and Employment. Ministry of Labor and Employment. ESI schemes, you should know 4 things. I'm telling only important stuffs. I'm not teaching like a classroom. Here I'm summarizing only important stuffs. ESI scheme 1, 2, 3, 4 thing. One is contribution. When I'm paying the insurance premium, what is the contribution? Contribution of employer, those who give employment, is 3.25%, and employee who works 0.75%. It has been changed now. This is the recent value, 3.25 by employer, 0.75% by employee. First update. Second, maternity benefit. So under ESI scheme, it is 26 weeks full wages for confinement. So it is up to 26 weeks for pregnancy. Extended sickness benefit for 2 years now. For chronic diseases, around 34 diseases are covered. It is for 2 years. That is extended sickness benefit. And fourth, funeral expenses, 15,000 now. Funeral expenses is not 10,000, it is 15,000 now. So tell me 1, 2, 3, 4 things you should remember. Mainly the updates I'm summarizing. Contribution 3.25 and 0.75. Maternity benefit 26 weeks. Extended sickness benefit 2 years. And one more is important, funeral expenses. Once in lifetime they will give 15,000 rupees. Good. Free days. Next step for free days. See the image. Sanitary pads under menstrual hygiene scheme only for rural adolescent girls, given through ASHA workers. Menstrual hygiene scheme, sanitary pads, rural adolescent girls by ASHA workers. 6 pads at 6 rupees. So it is 6 by 6. It is not free of cost. Clear? The word free days does not mean it is free of cost. Understand? 6 by 6. 6 pads, 6 rupees. Through ASHA only for rural adolescent girls. These pads are given through menstrual hygiene scheme under Ministry of Health and Family Welfare. Facility-based newborn care. I want to reduce neonatal mortality. Yes. What should be done at facility level, hospital level? What is the care given to newborn to reduce neonatal mortality? Means we need to have separate healthcare facilities at different levels. What we have, listen. Special newborn care units. Special newborn care units are also known as sick newborn care units, located at district and sub-district hospitals. If I am asking district hospital, what we have? SNCU, special newborn care units. Sub-district hospitals, yes, SNCU should be there. Come to next, community health center or FRU. We should have newborn stabilization unit. Newborn stabilization unit at CHC or first referral unit. Come to the last, every delivery point we should have newborn care corner. So listen, 1 SNCU, 2 newborn stabilization unit, 3 newborn care corner, top se niche. upper SNCU, below newborn stabilization unit, at last delivery points, newborn care corner. So delivery point, newborn care corner, CHC stabilization unit, district hospital special newborn care unit. Clear? Good. Come to next alphabet, important. They'll ask this plan G for global action plan for pneumonia and diarrhea. Pneumonia is the most common cause for under 5 mortality. How to prevent pneumonia and also deaths of diarrhea also. We have an action plan for the whole world. So the target of this plan can be asked, important, deaths from pneumonia. We have to reduce deaths from pneumonia to less than 3 per 1000 live births and deaths from diarrhea to less than 1 per 1000 live births. This data you should remember, and this can be one question because they are fond of pneumonia and also diarrhea. So what is the target of global action plan for pneumonia and diarrhea? This can be one question. One more update in alphabet G is global hunger index. Yes, the country wise they'll give a data. They'll summarize the level of hunger in a given country. That index is global hunger index. How many indicators are used? Before 3, now it is 4. There are 4 indicators used. Out of 4, listen, important, one by one. Percentage of undernourished population, 1. Second, wasting, means less weight for that age. Weight for age, if it is less, it is called as wasting. W for wasting, W for weight. Under 5 years, wasting is counted. Height, yes, stunting, under 5 years, stunting is counted. And also under 5, mortality is counted. Listen, 3 indicators are within 5 years. Wasting, stunting and mortality. Common sense. Wasting, stunting and mortality. Weight, height and death. Weight, height and death. Along with this, one more indicator, proportion of undernourished population. How many indicators are used within this index? Tell me. Good. 4 indicators. How to remember? Within 5, 3 things, weight, height and mortality, and one more thing is proportion of undernourished population. Yes, global hunger index, the value ranges from 0 to 100. 0 means no hunger, very difficult to achieve, and no country has value of 0. And 100 is extreme hunger, that is also not possible. So the value ranges from 0 to 100, and the ranking is given for countries, and they won't ask the value for India. If I want to tell the rank of India is 94, 107 countries are surveyed. This year they have done survey only in 107 countries, not in all the countries, selected 107 countries, and India is ranking 94 under global hunger index. But they won't ask value for you, they will ask indicators used under global hunger index. What is 0 in global hunger index? 0 means no hunger. Thank God, 0 means no hunger. Come to next alphabet H, important. Home-based newborn care. Home-based newborn care. You can see here, Asha worker is going to home and she is taking care of the baby. Here she is measuring the weight of the baby. That is also one function of Asha worker under home-based newborn care. A question was framed, measuring weight of the baby. That is also, you can see the image. Once you see the image, you will not forget. Asha worker is giving home visits, so that any danger signs she will refer to the hospital, so that you can reduce neonatal mortality. Home-based newborn care is given by Asha. Visits, yes, to reduce newborn mortality. The number of visits you should remember: home delivery 7 visits, hospital delivery 6 visits. Starts from birth itself. Home delivery starts from birth. Hospital delivery 6 visits. If it is vaginal delivery, cesarean section 5 visits. 0 frequency, I don't want to stress, it has been discussed in your class in detail. Just I am telling the important stuffs. Remember in descending order, 765, 765, clear one thing. And important, yes, to reduce neonatal mortality. For giving visits, Asha will be given incentives, correct. Cash incentives are given. 250 rupees per child. In most of the states they are giving 250 per child, not visit, 250 per child. If it is twins, it is double, 500. So Important thing is incentives are given 250 per child. Some states they have increased to 500, but most of the states still in the document they are writing it as 250 per child. So Asha worker, yes, they'll be given kit like this, Asha kit, and you can see there are some weighing machines, trucks, and also for measurement and some modules for training. Just I am showing this because once you see the image you will not forget. That is the main purpose of showing image also along with this discussion. Good. We have one more important scheme, that is HBYC, home-based care of young child. This is not neonate, it is for child. The visit starts from 3rd month. 3, 6, 9, 12, 15 means every 3 months. 3rd month, 6 months, 9, 12 and 15th month. Total 5 visits by Asha worker only. The main purpose is to counsel the mother regarding feeding, breastfeeding, when to immunize. So the purpose of this is to reduce mortality again. The counseling is the main purpose for feeding, when to start complementary feeding, when to immunize, what and all the vaccines to be given. This is the function of Asha worker under HBYC. Tell me what is 3 by 3? Starts at 3rd month, every 3 months 5 visits. 3, 6, 9, 12 and 15. Clear? This is home-based care of young child. One more H, Human Development Index update. 3 dimensions are considered: KIL, knowledge, income and longevity. So this has been discussed in detail in your class. Just I am summarizing the recent value. We take knowledge, income and longevity into consideration and discussing all important mean values, average values are taken, and the value of India is around 0.645 now. The value ranges from 0 to 1. The value of our country is 0.645 and we are ranking 131 in the list of countries as per Human Development Index. Good. Come to next. Alphabet I for Indradhanush, rainbow. Mission Indradhanush is for vaccines. Good. The national schedule what we are using, that has been termed as Mission Indradhanush. You can say it as Universal Immunization Program, you can say it as National Immunization Schedule, or you can give a name in a fancier way, that is Mission Indradhanush. Indradhanush is rainbow, targeting 7 diseases when it started. Now we are expanding and we are targeting around 12 diseases now. Not 7, it is 12 now. So the diseases important: tuberculosis, yes, we have BCG vaccine. DPT, diphtheria, pertussis, tetanus. So total 1 plus 3, 4 diseases. Polio, yes, we are using bivalent OPV and also fractional IPV. Measles, yes. Rubella, yes, we have MR vaccine targeting these 2 diseases. Hepatitis B within pentavalent. J in endemic states. Rotavirus, Rotavac, we have pneumonia and meningitis, yes, due to Hib. Hib is a part of pentavalent vaccine. So if I am counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Good. So Indradhanush, why it is Indradhanush? Because 7 colors, 7 diseases, that was the old thing. Now we have more and more vaccines to prevent more and more diseases. Now if they ask how many diseases, 12 diseases. This year, just last month, we had one campaign, that is Intensified Mission Indradhanush 3.0. What is the purpose of this campaign? In March 2021 we started and we did this campaign just because 2020 we had COVID. So many of the children, they might not have been vaccinated, left out, sound in between, some dropouts can happen. So to target them, to give vaccines to left out and dropouts which happened because of COVID pandemic, we have intensified Mission Indradhanush 3.0. No new vaccines, just common sense. We could not vaccinate children, yes, give one more opportunity in a campaign mode. Go to schools, go to communities, go to Anganwadi centers, vaccinate those children. They need vaccines. Yes, that is Mission Indradhanush 3.0 campaign to target Left-outs and dropouts because of COVID pandemic. Good. Come to one more. NAP, Indian Newborn Action Plan. Good. See the logo, they can show the logo also. Indian Newborn Action Plan target is important to bring down neonatal mortality rate to single digit neonatal mortality rate by 2030, and also single digit stillbirth rate by 2030. Usually they will ask neonatal mortality rate single digit by 2030. This is INAP ka target. So everything reducing neonatal mortality is a part of this plan, Indian Newborn Action Plan. One more, I for intensified National Iron Plus Initiative, Anemia Mukt Bharat, intensified National Iron Plus Initiative, iron folic acid tablets to prevent pneumonia. Important thing is different age groups will need different sort of supplementation. So let me summarize the age and dose of IFA tablets. Clear? I am taking the same table which has been given in your PDF of Anemia Mukt Bharat, so there won't be any confusion. This is the reference table. So the children aged 6 months to 5 years will be given bi-weekly supplementation twice a week. 1 ml syrup, dose 20 mg elemental iron, 100 microgram folic acid. So the dose is 20 1 ml will have 20 This is the dose. Frequency bi-weekly. Come to next. 5 to 9 year children, pink color tablet, weekly once. Pink color tablet, weekly once. Dose 45-400. Remember, pink color tablet dose you will forget in the exam. Remember this is 45-400. Age 5 to 9 years. Frequency once a week. Come to adolescents. Weekly once. IFA tablet. Blue color tablet. Iron ki neeli goli is for adolescent. Dose 60-500. Underline this number 60. Before it was 100, now it is 60. Weekly once IFA tablet. School going both boys and girls. Out of school only girls. Out of school only girls through Anganwadi centers. Blue tablet, important. Women in the reproductive age group. See the table from the PDF. They have given age as 20 to 49 years for INIP supplementation. Weekly once IFA tablet. Dose 60-500. Same as adolescent, but the color is red. Women in the reproductive age supplementation. Come to pregnant and lactating mothers. Daily one tablet from second trimester throughout pregnancy, and again postpartum they will get for 180 days. Means 180 plus 180 means 6 months during pregnancy, 6 months postpartum. So it is 6/6. Dose 60-500. Color red color tablet. What I want is summary. Daily one tablet, 6/6. 6 months. Dose 60 mg elemental iron, red color tablet. This is for pregnant IFA tablet. Folic acid periconception, that is totally different. Folic acid, it is to prevent neural tube defects. That is separate folic acid tablets in the first trimester. 400 microgram, that is different from INIP. That is folic acid 400 microgram during first trimester, and also 3 months before becoming pregnant if it is a planned pregnancy. That is periconception folic acid. This table is not discussing that. This table is for anemia. Iron folic acid tablet 6/6. Dose is 60 mg. 6/6 means 6 months during pregnancy, 6 months postpartum. Dose 60/500. Color red color tablet. So this is the summary of INIP. Important. Come to one more alphabet. I Indradhanush. Abhiyan Indradhanush is not Mission Indradhanush. Listen. Abhiyan Indradhanush is not Mission Indradhanush. One thing. Abhiyan Indradhanush is totally different scheme. It is under ESI hospitals. We are using colored bed sheets. Every day they will change. 7 days, 7 colors. They are using in the form of Vibyar pattern. V violet, Sunday. I indigo, Monday. By seeing the color of the bed sheet, you can say, today is Sunday, today is Monday. The purpose is to promote sanitation, to keep it clean. It's a part of sanitation campaign under ESI hospitals, changing bed sheets, colored bed sheets. This is Abhiyan Indradhanush under Ministry of Labour and Employment, because ESI comes under Ministry of Labour and Employment. Good. Next alphabet, J. Janani Suraksha Yojana, to reduce maternal mortality. The basic purpose of JSY was to promote hospital deliveries by giving cash incentives for pregnant and ASHA worker, so we can reduce maternal mortality. The cash incentives under JSY for ASHA worker is important. If you can remember, for ASHA it is 600 rupees in rural areas and 400 rupees in urban area. Listen, 600 rupees for rural area and 400 rupees for urban areas, because JSY gives more importance to promote deliveries, hospital deliveries from rural areas. So incentives will be more for rural areas. Cash incentives for hospital deliveries for both ASHA and pregnant, JSY scheme. JSSK Janani Shishu Suraksha Karyakram is different. That is to eliminate out-of-pocket expenses by giving free services. Everything is free in this: free diet, drugs and diagnostics, free transport, cesarean section for pregnant and sick infants. It is not sick neonate, now it is sick infant. Services are given till 1 year. Diet, drugs, diagnostics, transports and also cesarean section. This is JSSK scheme. JSY will give cash, JSSK will give free services. Important. K. Next alphabet, Kilkari, something related to vaccine. Application, yes, data will be entered, and depending on the dates, that will give one reminder, audio reminders to promote vaccination status, to reduce dropouts, to reduce leftouts. Depending on the dates, vaccine due date, yes, audio reminders will be given. That is Kilkari scheme for vaccine audio reminders. K for Kayakalp, logo will be asked. See the logo. This is rejuvenating public health facilities. Yes, means promoting hygiene in government hospitals, promoting sanitation. Different parameters are considered. If your hospital is meeting this much amount of quality sanitation standards, incentives are given, awards are given. Kayakalp awards are also given, cash awards are given. So the purpose of Kayakalp: 1. Sanitation. 2. Only government hospitals. Yes. 3. Cash awards are given. Yes, cash awards are also given. You should know salient features, not everything. If you read everything, will forget everything. At last, during exam, you should know main points, so that you will get some amount of confidence going into the exams. So always must know points are very important. I am discussing only must know points for program updates in alphabet mode. Next alphabet, L for Lakshya scheme, labor room quality. This is a scheme to improve labor room quality. L for Lakshya, L for LA, labor room, Q for quality. Lakshya is for labor room quality in government hospitals, correct. Not in primary health centers. This scheme is not applicable to primary health centers. It is applicable to community health centers and above, sub-district, district hospitals, medical colleges. This is Lakshya scheme, not in primary health centers. Leprosy treatment guidelines, important. Now the thing is, we are using same drugs for both POSI and multi. Drugs are same, but duration is different. POSI-bacillary 6 months, multi-bacillary 12 months. Duration is double for multi-bacillary leprosy. The pack is same. See this, rifampicin 600 mg, 2 capsules. Clofazimine 300 mg, 3 capsules. Dapsone 1 tablet, 100 mg. This is on day 1. Next, for the remaining days, 50 mg clofazimine and 100 mg dapsone. So this is for 1 month. Rifampicin, clofazimine, dapsone, and clofazimine and dapsone. Clear? And the duration is 6 months for posi and 12 months for multi. Important. So next, alphabet. MA scheme, that is mother's absolute affection. Mother's absolute affection, it is related to breastfeeding. So it is to promote breastfeeding and also giving counseling services, how to breastfeed or when to start complementary feeding. So under MA guidelines, if they ask, the breastfeeding should be started as early as possible, preferably within 1 hour, that is to start. Then complementary feeding should start at 6 months, correct? And continued breastfeeding. Breastfeeding should be continued till 2 years. So these are the guidelines under MA. Main thing is related to breastfeeding. Counseling services are also given under MA scheme. Mother's absolute affection is related to what? To promote breastfeeding. MCTS, Mother and Child Tracking System, is it's a tracking the mother and also the child for the services they have to receive. They are given 18-digit unique identity number. When they register, they will be given an 18-digit unique identity number. With the help of that number, we can track the mother and also the child for the services to be given. M for Mission Parivar Vikas, one more related to family planning. So the methods introduced, 1 we have discussed, Antara, 2 Chaya pill, 3 POP, progesterone only pills are also introduced only for lactating mothers, improved contraceptive packaging, and also holistic family planning media campaign to create awareness for family planning. So these are the 5 things under Mission Parivar Vikas: Antara, Chaya, POPs, improved contraceptive packaging, and holistic family planning campaign. So these are the things under Mission Parivar Vikas related to family planning. Good. Monica scheme, they repeatedly ask this question. Monica scheme is monitoring determinants related to cardiovascular diseases. It's a WHO project where they do survey for determinants in the community. What are the risk factors existing in the community related to cardiovascular diseases? MON, monitoring CA, cardiovascular diseases, WHO project to assess risk factors. Midday meal scheme, one more M. We don't have midday meal program now. Whatever we have is midday meal scheme. See the logo. You can see the school children sitting in a circle having their midday meal together. Good. Midday meal scheme under schools. It is under Ministry of Education. This is the newer update. Previously, the same ministry was called as Ministry of Human Resource Development. Just last year, they have changed the name of Ministry of HRD. They named it as Ministry of Education in the center. If they ask, MMS is under Ministry of Education, correct. Previously, the same ministry was named as Ministry of Human Resource Development. That was the previous name. 1. And when they provide midday meals to school children, the principle when they cook their midday meal is their requirement, half of protein requirement and 1/3 of calorie requirement should be met. Half and 1/3. Half of protein requirement and 1/3 of calorie requirement should be met. So in such a way that they have to plan a midday meal. These are the important things. I am stressing only important points which are repeatedly asked in the exams. And one more M is campaign, MR, measles rubella campaign. See this. An ANM giving vaccine subcutaneous route into the right subcutaneous fold. MR campaign, it is catch-up vaccination. You go to the community, schools, Anganwadi centers, give vaccine. Any child between the age of 9 months to 15 years. If I am getting a child between the age of 9 months to 15 years, 1 dose of MR vaccine is given. I'm giving one dose. That is MR campaign. Catch up mode. The whole state is covered. After covering, if that state has finished this campaign, in the routine schedule, they can introduce MR vaccine for routine cohort also. Before introducing routinely, you have to finish one campaign. That campaign is MR campaign, measles rubella campaign. Good, important age group 9 months to 15 years for India. 9 months to 15 years for India, one dose of MR vaccine. After finishing campaign, you can make a change in the routine schedule, introduce MR vaccine routinely also. Come to next alphabet N for Nischay, confirmation pregnancy testing kits. So UPTs, detecting HCG, urine pregnancy testing kit, detection at community level also. Asha worker will also have this kit and she can detect pregnancy. Sub-centers ENM will have this kit, they can detect pregnancy. It is for pregnancy confirmation. Don't confuse with tuberculosis. NEET-CET, it is a website. CET is tuberculosis. NEET-CET is something related to TB, where you notify tuberculosis. TB is a notifiable disease in India now. Not to WHO, within India it is notifiable. Through which website you are notifying? To district TB officer, to DTOs you are giving monthly reports. Notification through which website? It is NEET-CET for tuberculosis. Mandatory notification of TB is must through NEET-CET website. N for NSSK, Navjat Shishu Suraksha Karyakram. You can see ANMs, medical officers, they are being trained by pediatrician. They will give training for them related to newborn care and resuscitation. You can see here, care for newborn care and resuscitation. Once you train them, they go and they can prevent neonatal mortality. NSSK is training for healthcare providers mainly for neonatal care, newborn care and resuscitation. They will also train to prevent deaths due to hypothermia also, how to manage hypothermia, how to maintain warm chain. So NSSK is training initiatives to reduce neonatal mortality. Correct answer. NC days 25 by 25 target is important. Non-communicable disease. What is 25 by 25? We are reducing mortality by 25%. Premature mortality caused by non-communicable diseases like cardiovascular diseases, cancer, stroke by 25%. By which year? 2025. It is for mortality. Non-communicable diseases 25 by 25. By 25% you are reducing. By which year? By 2025. Instead is what is 25 by 25? Correct. Open vial policy for vaccines. You can see the vial here and they are mentioning the time 9:40 AM. Good. Date 23/9/2017. It is inactivated polio vaccine. Yes, fine, clear. Why they are putting the date and time? Because the same vial, if something is left, they can use it for next 4 weeks. In the subsequent sessions, maximum duration 4 weeks. For this vial it is applicable. Means to reduce vaccine wastage. I don't want to waste my vaccines. It is not applicable for all the vaccines. It is applicable for most of the vaccines. Date and time is mentioned. It can be used in the subsequent sessions till 4 weeks from the date of usage. For which vaccines it is not applicable? Important 4 things: BCG, measles or MR, Japanese encephalitis, Rotavac. Tell me it is not applicable. I'm telling. Means you can't use in the next sessions. BCG, measles or MR, Japanese encephalitis and Rotavac. Just remember these 4 things. And for remaining it is applicable. Keep it simple. For these 4 it is not applicable. BCG, measles or MR, JE and Rotavac. For remaining it is applicable. Open vials can be used for vaccines with date and time only for few vaccines and not applicable for 4 vaccines. Good. Next alphabet P. Pradhan Mantri Surakshit Matritva Abhiyan. See here. Pradhan Mantri Surakshit Matritva Abhiyan. On 9th of every month, PMSMA clinics are done from primary health center onwards. CHC, district hospital, doctors will have sit. They will attend the clinic. A pregnant coming, any danger signals, they are identified. Danger signals are identified on examination and investigations. Something abnormal is detected, you are giving some stickers. So PMSMA clinics to identify danger signals to reduce maternal mortality. How many stickers are used? 1, 2, 3, 4. 1, 2, 3, 4. 1 green, normal, nothing. Red, high risk. Traffic signal, green, red, high risk. Then come to blue and yellow. Blue, blood pressure, pregnancy induced hypertension, important. Yellow, comorbid conditions like STD, diabetes, hypothyroidism. STDs, diabetes and hypothyroidism. Green, red, blue, yellow. Green, red, blue, yellow, important. To reduce maternal mortality, identifying danger signals, PMSMA scheme. See the photos, you will not forget. Once you see the image, you will not forget. That's why I am putting images there. PMMEY, Pradhan Mantri Matru Vandana Yojana. This is totally different scheme. Previous scheme was by Ministry of Health and Family Welfare, but this scheme, Pradhan Mantri Matru Vandana Yojana, is by Ministry of Women and Child Development. Ministry of Women and Child Development, important. What they are giving in this scheme? Cash incentives. Yes, for first child, not for all the live births, for first live birth, for first child. How much? 5,000 rupees cash. Listen, in 3 installments, they are giving in 3 installments now. Total 5,000. This is the update. 3 installments, 5,000 rupees for a pregnant, for first child, not for every child. It is for first child. Clear? This is Pradhan Mantri Matru Vandana Yojana. Pradhan Mantri Jan Arogya Yojana for health insurance. See, this is the logo for Pradhan Mantri Jan Arogya Yojana, also known as Ayushman Bharat. Ayushman Bharat Health Protection Scheme. Health insurance is given for inpatient expenses. So once you register there, they will give Ayushman Bharat health card, and this is applicable within a family. Insurance coverage of up to 5 lakh per year per family. Up to 5 lakh per year per family. So it is irrespective of family size, not for 1 member, 2 member. It is irrespective of family size and also irrespective of age of family members. Services can be availed only for inpatient expenses, irrespective of family size, irrespective of age of family members. So this scheme is applicable in all the government hospitals and selected private hospitals. What is Poshan scheme? Nutrition Poshan Abhiyan. Poshan ka full form. Prime Minister's overarching scheme for holistic nourishment, NS nourishment. Nutrition. This is the logo of Poshan campaign. Poshan Abhiyan ka logo hai. This is the logo of Poshan campaign. Poshan Abhiyan, important. So what they are doing to promote nutrition? Next, to reduce undernourishment, low birth weight, anemia. So we are reducing undernourishment, low birth weight and anemia, and also stunting. Stunting is important. So what is 25 by 22? 25 by 22. 25 by 22 is one of the target under Poshan. 25 by 22. What is 25 by 22? To reduce the prevalence of stunting to 25%. To reduce the prevalence of stunting to 25% by 2022. 25% तक लाना है prevalence of stunting. It is around 38 now. To bring it to 25% by 2022. This is 25 by 22 related to stunting. One of the target to be achieved under Poshan campaign, Poshan Abhiyan. From next alphabet R. RNTCP, Revised National TB Control Program, that has been renamed as National TB Elimination Program. So this scheme has been renamed as National TB Elimination Program. First update. So within this, treatment for tuberculosis patients. Listen, all TB patients new and previously treated. So all tuberculosis patients will be given daily regimen. First thing. So the duration is for 6 months. Second thing, the body weight is considered. Dosage is based on body weight and fixed dose combinations are used. Like we are using 4-FDC in intensive phase, HRZD in intensive phase for 2 months and remaining 4 months of continuation phase we are using HRE. So listen, it is 2 HRZE plus 4 HRE. So 2 plus 4, 2 months of intensive phase, 4 months of continuation phase. We are using 4 drugs in intensive phase and 3 drugs in continuation phase. 4-FDC means fixed dose combination with 4 drugs are used in intensive phase. So I'll summarize this. All TB patients will get same treatment. Duration 6 months. Frequency daily regimen. Fixed dose combination, yes. Dosage based on body weight. 5 weight bands are used in adults. Listen, 5 weight bands are used in adults. So fixed dose combination in tuberculosis, correct. For all TB patients, 2 HRZD plus 4 HRE, 2 months of intensive phase and 4 months of continuation phase. The image shown is for intensive phase. Daily regimen. Universal DST, drug susceptibility testing is done to check rifampicin resistance for all tuberculosis patients. Initially we are doing universal DST, correct. Mandatory notification. If there is a case of TB, notification is must. Notifier will get 1000 rupees per patient. 1000 rupees per patient. Nikshay Poshan Abhiyan, to promote nutrition. All TB patients will be given 500 rupees per month. 500 per month during treatment to promote nutrition. 99 dots. See the image. If the patient is opening the blister pack, a hidden number will come out and that number, patient is giving missed call to that number. Once he is giving missed call, we are checking whether he is taking drugs or not. This 99 dots is missed call initiative to check adherence to TB treatment, whether the TB treatment they are taking drugs or not. This is one way of monitoring their adherence to treatment. So these are most important points for tuberculosis. National TB Elimination Program, RNTCP, has been renamed as NTEP, National TB Elimination Program. Important. Next, RKSK, Rashtriya Kishore Swasthya Karyakram. See the logo for RKSK for adolescents. Rashtriya Kishore Swasthya Karyakram. Important strategies for adolescents 10 to 19 years. Important thing to promote mental health. One thing, to prevent non-communicable diseases, to prevent substance abuse, injuries, 1, 2, 3, 4, to promote adolescent reproductive and sexual health, and also to promote proper nutrition. Total 6 strategies can be asked under Rashtriya Kishore Swasthya Karyakram. Mental health, non-communicable disease, substance abuse, tell me good, injuries, sexual health and nutrition. These are important strategies for Rashtriya Kishore Swasthya Karyakram. Rashtriya Bal Swasthya Karyakram, where you do screening. After doing screening, early intervention can be taken. Screening is done in the age 0 to 18 years, from birth till 18 years. Schools, yes, we do screening because the upper limit is 18 years. After screening, early intervention will be given. Screening for 4 Ds: defects, diseases, deficiencies, developmental delays and disabilities. Defects, diseases, deficiencies, developmental delays and disabilities. Deficiencies important, nutritional deficiencies like vitamin A, anemia, vitamin D. So very important question will be framed on nutritional deficiencies to be screened. Anemia, vitamin A, vitamin D. Remember this Rashtriya Bal Swasthya Karyakram. All the important points I am discussing here. Remaining in detail, it has been discussed already in your classes, but within 1 hour I am summarizing all the updates in alphabet mode. That is the motto of this discussion. Come to next alphabet. S for Satya. Satyas are counselors. See, you can see adolescents. They are being trained under this scheme, RKSK scheme. They will be given training and they will go and counsel their adolescents in the community. First we are training them and they will go and counsel the remaining adolescents. Any health issues are there, Satyas are available at community level for adolescents to discuss their health issues. Satyas are counselors under RKSK, Rashtriya Kishore Swasthya Karyakram ke andar they will counsel the adolescents. Good. Suvidha pads, again these are sanitary pads. Just like free days from Ministry of Health and Family Welfare, this is from Ministry of Chemicals and Fertilizers. These are biodegradable pads to promote menstrual hygiene. Suvidha pads, again the cost has been revised now. It is 1 rupees per pad. Before it was 2, now it is 1. 4 pads, 4 rupees, 4 by 4. So Suvidha, yes, to promote sanitation, menstrual hygiene, correct. Biodegradable pads, correct, under Ministry of Chemicals and Fertilizers, correct. Sparsh campaign, Sparsh touch, leprosy, we have loss of touch sensation. So Sparsh is related to leprosy. Sparsh campaign is creating leprosy awareness in the community. Posters are given in the community like leprosy manifest like this. Once you have these sort of symptoms, please come to hospital, take treatment, it is curable, like that. Sparsh campaign is to create awareness for leprosy. Within Sparsh we have Sapna. She is a mascot, school kid. She will be telling the messages to the community. Whenever there is a poster, we paste Sapna into that. Through Sapna we deliver messages into the community so that the community will get attracted towards school kids. She is saying something, have to listen. This is a way of creating awareness so that you catch the attention of the people. S for Sparsh, S for Sapna, both are related to leprosy. Sparsh is a campaign to create awareness. Sapna is a mascot under Sparsh to create awareness for leprosy. Good. One more as Suman scheme for mothers. It is Surakshit Matritva Ashvasan scheme. See here. It is an initiative to achieve zero preventable maternal and newborn deaths. So what we are doing in this, we are guaranteeing the services. Suman scheme is for pregnant, newborn and also for postnatal days, like till 6 weeks the services are given. The main services like free treatment, transport, everything is given and it is guaranteed. Ashvasan means service guarantee charter is available. Every hospital will pay service guarantee charter, like these are the services to be given and it has to be given. Guarantee mechanisms are also there and if it is not given you can complain. Grievance redressal mechanisms are also available under Suman scheme. The purpose is services to be given and guarantee should be done. It is Ashvasan, Matritva Ashvasan, we have to protect the mother. So under guarantee is also given. Like I want to say 2 G's. Guarantee charter and grievance redressal. Guarantee charter and grievance redressal is also available under Suman scheme. One more is SANS, breathe. It's like for pneumonia, social awareness and action to neutralize pneumonia successfully. SANS ka full form it is awareness and action to neutralize pneumonia successfully, to prevent under 5 mortality. What are the things done under SANS campaign? At the community level, we are creating awareness. One thing, these are the danger signs. If you have this, please come to hospital. Creating awareness. Second, pre-referral dose of antibiotic by ASHA worker. That is also one more initiative. Pre-referral dose of antibiotics by ANM and also ASHA worker. They are being trained in that. Pre-referral dose of antibiotic for a case of pneumonia. And one more is pulse oximeters are also kept at health and wellness centers. We have health and wellness centers at grassroots level. Pulse oximeters are kept to check the saturation, to diagnose, so that we can refer and we can manage pneumonia, we can prevent deaths due to pneumonia. Important schemes: SARS, breathe, pneumonia, remember, very good. Come to next. U, next alphabet. We have 3 schemes under this. U for Ujala, Roshni, bulb. See the logo, Ujala scheme. It is Unnat Jyoti by affordable LEDs. We are giving energy efficient bulbs at an affordable rate, not free of cost, at an affordable rate under domestic efficient lighting program. It is not free of cost. One thing, it is at an affordable rate. Energy saving, yes, correct. And it is under Ministry of Electricity, Ministry of Power in the center. Ministry of Electricity or Ministry of Power in the center. Ujjwala Yojana, Pradhan Mantri Ujjwala Yojana. Listen, it is giving free LPG cylinders, free LPG connection to below poverty line BPL families. Clean fuel, better life. You can give clean fuel, reduce indoor pollution also. You can promote the health. At the same time, they are using LPGs. Efficiency is more. This is Pradhan Mantri Ujjwala Yojana under Ministry of Petroleum and Natural Gas. Ministry of Petroleum and Natural Gas. There is one more scheme which sounds like this. That is Ujjwala scheme to prevent women and child trafficking. This is under Ministry of Women and Child Development. So listen, one is Ujjala, Pradhan Mantri Ujjwala Yojana, and Ujjwala scheme to prevent women and child trafficking under Ministry of Women and Child Development. I am giving 3 things in one slide, just because you keep on asking questions on this. What is this? What is this? These are the things, and this is the correct way of saying these things. And there is an image beside so that you won't forget. Once you see the image, you will not forget. Ujjala bulbs, Ministry of Power. Pradhan Mantri Ujjwala Yojana, Ministry of Petroleum and Natural Gas. Ujjwala scheme for trafficking, preventing trafficking, that is under Ministry of Women and Child Development. Good. Come to the last alphabet, WIPS. Weekly iron folic acid supplementation. W, this is the last update in this video. Weekly iron folic acid supplementation. You are giving blue color IFA tablets for school going adolescents, both boys and girls, 10 to 19 years, in both rural and urban areas. Blue color IFA tablets. Dose is 60 mg elemental iron, 500 microgram folic acid. It is only for school going adolescents. WIPS is a part of INEP, correct, but only for school going adolescents. We have discussed this blue color tablets, 60 mg elemental iron and 500 microgram folic acid. So it is IFA supplementation weekly once, blue color. Screening is also done in this for moderate and severe anemia. We also do biannual deworming under WIPS, and also we counsel for nutrition. So screening for anemia, IFA supplementation, deworming and counseling for nutrition. WIPS, it is for school going adolescent, both boys and girls. So coming to the last slide where you ask for recent data, IMR, MMR, NMR, you should know that infant mortality rate is around 32 per 1000 live birth now. The target is 28 to be achieved by 2019. That was not achieved. So target set was 28 by 2019 as per National Health Policy. That target was not achieved because the recent value is 32. Infant mortality. Second, neonatal mortality rate is around 22 now. But the target is very, very important. Single digit neonatal mortality rate by 2030, that is by Indian Newborn Action Plan target, single digit. And SDG target, Sustainable Development Goal target, is to bring it down to 12 or less than 12. So 12 or less than 12 by 2030. This is SDG target. Listen, INAP and SDG targets are different. You'll be asking this question. INAP and SDG targets are different, correct. INAP says single digit, but goal, Sustainable Development Goal, says 12 by 2030. But depending on the question, if they ask INAP, single digit. If they ask SDG, well by 2030. Good, correct. Under 5 mortality rate is 34 now, 34 per 1000 livers. The unit is per 1000 for everything, so just remember the number 34. The target, we have to bring it to 25 by 2030. That is Sustainable Development Goal target. Come to MMR, 113 per 1 lakh livers. Important, this is a recent data, it is 113 maternal mortality ratio. The target should be less than 70 by 2030. Less than 70 per 1 lakh live births by 2030 as per Sustainable Development Goal. These 4 are very, very important. And they can ask crude birth rate 20, crude death rate 6.2. The unit is 1000 mid-year population. Annual growth rate is 1.38%. In percentage, it is 1.38. When you subtract these two things, 20 minus 6.2 will get 13.8 per 1000. But in percentage, it is 1.38 per 100 or 1.38% growth rate, annual growth rate. Come to total fertility rate, it is 2.2 now. The target should be 2.1 as per National Population Policy. So this table, pause it and take a snap. This is the data which you want for exam. No need to remember everything. If possible, remember targets of neonatal mortality rate, MMR, IMR and under 5 mortality rate. These 4 things are important for me, but very, very important is neonatal mortality rate target, neonatal mortality rate target, and also MMR target. MMR target. Last time question was on MMR, maternal mortality ratio. Fine, I have summarized all the updates for you from A to Z within 60 to 65 minutes max, so that this video will give some confidence for you, so that you say, sir, I know something. And if the question comes, yes, there is not much of a confusion, I have some clarity regarding schemes and updates, and I can manage myself. Yes, you can manage. Once you see this video, you'll get that confidence and that sense of calmness is very, very important. So finally, one more message. मैं उड़ना चाहता हूँ, I want to fly. दौड़ना भी चाहता हूँ, I want to run. गिरना भी चाहता हूँ, in between I can fall because life is full of up and downs. बस रुकना नहीं चाहता, I don't want to stop. Yes, anything can happen. Sometimes it's against me, sometimes it's towards me, but yes, I don't want to stop. I will never ever give up. Yes, believing in your instincts, backing your instincts is more important. Start expressing yourself. I'm telling, start expressing yourself. The more and more free you are within yourself, the more and more creative you will be. Things will fall in place. What I want to say is, bas don't stop. Bas rukna nahi chahta. Yes, I will give my best. Sometimes I may fall, sometimes I will learn new things, but whatever I am doing, I am trying and I am giving my best. Go and start expressing yourself. Things will fall in place. All the best. Thank you so much.